Jupiter Medical Center is a regional medical center in South Florida. We are a system of care that we like to describe as patient-centered. I think what makes us very different is our affinity to technology.
I think with modern medicine, oncology in particular, the pace at which the information comes out, that the treatment pathways change and evolve, is an ongoing challenge for an oncologist, but a physician in general.
Last year there was over 11,000 articles printed related to breast care. And I'll tell you, that's probably, myself as a surgeon, that's probably one of my biggest challenges, is that staying on top of the literature and the research. There's no way that one single doctor, or even the group of doctors that we have, if we all divide it out, that we can possibly stay on top of that.
Being able to have a relationship with Watson where we continue to evolve the tool, it gets customized over time to an individual user's need, has been awesome. And we are in the process of figuring out the best algorithms, the best way to have it integrate into a patient flow to maximize the patient experience, but also help the clinician in maximizing their decision making.
It's a tool. It's not going to replace physicians, but it is certainly going to aid them. It's certainly going to provide them a set of information that will change the way they think and treat patients. And that's great. That's what this whole thing is about.
In terms of surgery, the big question you have in cancer care, and especially in breast cancer, is whether to have, for patients who do need chemotherapy, whether to do chemotherapy then surgery, or surgery then chemotherapy. So with Watson Oncology program, it really shows at what point would surgery be most appropriate. And sometimes that's a pretty big dilemma, and that's actually something that we discuss, a lot in the tumor boards and have some debate about.
We believe strongly that this is the future of medicine. The goal is to continue to allow clinicians and physicians to get access to the most amount of information possible.
And how I see the benefit of Watson in our tumor board is I still want to go with our same process of how we're presenting patients, discussing patients, but when we get to the actual treatment plan, we have some debate. Maybe we all think that we agree on the treatment plan. I kind of want to use that as kind of a check and balance. Say, okay, what does Watson say about the oncology program for this particular patient? Maybe we could run all of our patients through tumor board and use this to check it. So only versus 4 cases, maybe we could do 15 cases and really do a thorough, good job in a smaller amount of time.
We're an organization that likes to push the envelope. We like it because we think our patients deserve it. So to hook up with a world-class organization like Watson Health for Oncology just fits with who we are as an organization.
I think the future of oncology will continue to transition to more individualized decision-making or care. And that may take on forms that we don't even understand today. Tools that allow us to understand an individual patient's DNA, their genetics, information about their tumor biology, all of those things need to be integrated and synthesized through huge databases of information that will far surpass what a physician will be able to process in an efficient way.
Not only do I think IBM Watson Health Oncology is going to make a huge difference in the lives of our physicians and our patients, but I believe that IBM Watson Health will make an enormous difference in our institution. This is not an endpoint. This is the beginning of a very long journey for us.